3, 2.
Hello, everybody. Good afternoon and welcome to our weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. James Bridgers, Director of the Department of Health and Human Services, as well as Dr. Nina Ashford, who's Chief of Public Health for the county, Mr. Sean O'Donnell, Acting Deputy Director of Public Health, as well as Dr. Earl Stoddard, Assistant Chief Administrative Officer. Thank you for joining us. Good afternoon, Mr. County Executive.
So good afternoon, everybody, and thank you for being here. I'm going to do a spoiler alert first. So don't ask me any questions about taxes because I'm not raising them. So there is no tax increase in this year's budget. Now back to the other news. So it's been a big week and a big day for Montgomery County. This morning, I joined Council President Andrew Feitz and other county and community leaders to announce the latest round of security grants to help facilities at risk of hate crimes. We've awarded $900,000 of grant money that will help protect some of the most vulnerable people in our community. And this money can be used to pay for security guards, to establish the safety plan, safety training, or on new security cameras. And this is the second consecutive budget in which we've made grant funding a priority, with $800,000 awarded in January of 2023 as well. There were more applicants this time than last time, as you'll see in the budget package that I sent to the council tomorrow, that I'm sending over tomorrow. The total is 1.2 million. We have 900,000 in the actual immediate budget document, and we're anticipating another $34 million in revenue from FEMA as a reimbursement from our COVID expenses. And because we didn't get it before the budget was actually put into print, we can't count it until it actually comes in, but we're expecting it. It could literally be any day. So when that comes in, we'll modify the budget and it'll add another $300,000 to the grant package for a total of $1.2 million. We can also tell the need for this kind of help is rising by looking at the request for police support from our faith community. With the onset of the war between Israel and Hamas, concerns over vandalism and the potential violence has risen considerably in both Montgomery County and around the globe. It's not lost on me that today's announcement comes as Ramadan is just beginning. It's a very important month for Muslims that call Montgomery County home, and many more all over the world. And it's a time for reflection and sacrifice. And I wish everyone who's participating Ramadan Mubarak. Hateful acts, vandalism, and the use of vile language against innocent people are things we will not tolerate in our community. We cannot allow hate to poison the diverse home that we all share. We all deserve a safe and inclusive community. No one should have to worry about their safety when they walk into a church, a synagogue, or a mosque. Nobody should be worried about if being harassed because they're wearing a headscarf or yarmulke or clothing that's symbolic of any particular ethnic group. You should be able to go about your business in the county with whoever you are and be treated like everybody else without distinction. We were proud to welcome Maryland Governor Wes Moore and Lieutenant Governor Runa Miller and their cabinet to Montgomery County last Friday. They held their cabinet meeting at our beautiful Strathmore facility, and after that, we had 4 different bus tours for the cabinet. They didn't all do 4 tours. We divided into 4 groups. Members were able to see various highlights around our county, discussing public safety, economic development, and housing and the environment. I accompanied the governor on a tour of the police department's new drone as first responder program. The pilot program started in Silver Spring and recently extended to Wheaton. And next we'll be expanding this area to Germantown, Gaithersburg, and then Bethesda. We also visited with members of Urban Search and Rescue, Maryland Task Force Number 1. This group is a highly specialized team sponsored by Montgomery County Fire and Rescue Services, whose services are often needed across the nation in the most desperate situations. They're just one of 28 federally funded urban search and rescue task forces in the continental United States. Another bus took Lieutenant Governor Runa Miller, along with the Secretaries of Commerce, Transportation, and State, to the newly opened University of Maryland Institute for Health Computing offices in North Bethesda. Yes, they are here now. They were able to meet with University of Maryland leaders and learn how the graduate program focused on modern health would be growing in the coming years. The Life Science Research Initiative is meant to help improve the health of our state and beyond. It's also meant to be a place where innovation and business come together and will help the life science industry to continue to grow in the capital region, and particularly here in Montgomery County. Lieutenant Governor and Cabinet Secretaries also got to learn about our future bus rapid transit plans on 355. They were addressed by presidents of both Montgomery College and USG about their workforce development and training programs. And they concluded their trip with a visit to GSK, GlaxoSmithKline, one of the county's largest life science employers. This was a great opportunity to highlight the Lieutenant Governor and Cabinet members and show them how Montgomery County is the epicenter of the third largest life science cluster in the region. And the potential for growth of this industry is enormous, and it has real implications for the state in terms of good paying jobs and incredible opportunities for business growth. And we believe that business growth will spread not just into Montgomery County, but it will spread to other opportunities around the state. The Environment and Housing Secretaries visit our innovative Brookfield Bus Depot and microgrid, as well as stop by the county's largest affordable housing project under construction at Bushy Drive and Randolph Road. And the Health and Juvenile Services and Social Service Secretaries visit our mobile crisis team at the county's crisis center with our HHS team. Unfortunately, we do not have the time or capacity to show the governor's cabinet more of what we're doing here in the county, but we look forward to them returning again soon. And we've had many cabinet secretaries visit and talk to us, so we do get the chance to bring them and show them different things around the county that we think are worth their knowing about. We clearly have a different administration in charge of the state, one that's much more willing and much more open to partnership and collaboration and communication. I want to thank Governor Moore, Lieutenant Governor Miller, and their administration for taking the time to visit Montgomery County. Last Friday was a busy day because hours before the meeting with the governor, I helped celebrate the completion of the dedicated bus lane project on University Boulevard in Wheaton. And if you've driven in DC, you've probably seen the red paint before. This bus lane serves several Ride-On and WMATA Metro bus lines. The plan is to monitor the lanes as a pilot program for 12 months while evaluating their effectiveness. And the project should help improve the daily commute for many of our regular bus riders. But more importantly, the fact that it is in a dedicated lane and has a greater ability to maintain higher speeds, it should help attract more riders to public transportation. When people are stuck in a bus in traffic, their perception is there's no difference in doing this and driving, and it may even take longer. And so the key in attracting riders to buses is to get the times to be the same as your journey by car, or to actually get it under the journey by car. And that's what we're striving to do. The dedicated bus lanes are part of a larger MC.DOT initiative, the Bus Priority Project. The initiative aligns with the county's overall commitment to an equitable, safe, and eco-friendly transportation system. And the implementation of dedicated bus lanes is an effective strategy in reducing reliance on single occupancy vehicle trips and increasing public transit usage, an action pulled from our county's climate action plan. Over time, we expect a reduction of daily vehicles on this busy county thoroughfare, which in turn will make a significant impact in lowering our greenhouse gas emissions caused by transportation. The transportation sector currently makes up about 42% of Montgomery County's total GHG emissions. The red bus lanes cover over 2 miles of roadway right now in each direction from Amherst Avenue to Dennis Avenue, and they'll be able to help buses minimize traffic obstructions, provide faster and more reliable bus service along that congested corridor. And almost next in line, something project that will begin in earnest this year will be the Veers Mill bus lanes that'll connect Wheaton to Rockville, closing the northern end of the red line together. The University Bus Lane corridor serves 3 Ride-On, 2 Metro buses. The C2 and the C4 Metro bus lines carry about 9,300 riders each weekday, and it's the second highest ridership route in the Washington, D.C. region. So hopefully those folks and people who would like that opportunity will get to see a real improvement in their times. Apart from buses, these lanes will allow for bikes and emergency vehicles. Additionally, the bus lanes will provide a buffer from high-speed traffic for people walking along the sidewalk on University Boulevard. Students from Northwood High School will benefit from the safer walking conditions as well. An efficient and reliable transportation system is key to accommodating a growing population, and we're dedicated to making our climate-conscious choices more attractive and, of course, efficient for our residents. So this month marks 4 years since the first cases of COVID were diagnosed in Montgomery County, and which were the first cases of virus that were actually diagnosed in the state. And on March 11th of 2020, the World Health Organization declared COVID-19 a global pandemic. Within a few days, schools and workplaces across the nation were closed, and our best defense from the virus at that time was social distancing. It was the beginning of the worst pandemic in the last 100 years. It was not like anything we'd ever dealt with before. We've had snowstorms, we've been, had a derecho, we've had hurricanes. Nothing has been really as disruptive to life for as long a period of time as the COVID epidemic was. And 2 years later in 2022, things looked a lot different. That year, we held a candlelight vigil at Marion Friar Plaza to honor nearly 2,000 people in Montgomery County that have been killed by COVID-19 up to that point. We had endured a lot of stress, worry, and concern, and the death of loved ones haunted a lot of people. And it was particularly hard when people couldn't see their loved ones in a hospital, weren't able to be there with them in their last hours of life. And so it was no doubt hard on those who were passing away, but it was really hard on the loved ones who wanted to be a source of comfort and weren't able to do that. So I think we all recognize how difficult COVID was for a lot of people. There's been a lot of isolation, there's been a lot of heartbreak, and yet still there are reasons to avoid gathering indoors in large groups. And, we were able to, and most residents chose a path of getting vaccinated and making sure they stayed safe, healthy, and alive. We also took the opportunity that night to thank the first line defense in the battle against COVID-19. I really want to reiterate my appreciation for the nurses, doctors, medical community that worked countless hours and put their safety at risk to save as many lives as possible. And one of the very worst things about the beginning of this is nobody had gowns, nobody had masks, nobody had stocked up for a pandemic where you would have to be masked every minute of your workday, and probably if you're using public transportation, however long it took you to get to and from work. Nobody had stocked up for an event like that. And that wasn't just true in Montgomery County, it was true nationally. So we scrambled to find sanitizer, face masks, and gowns. The county actually provided those supplies to hospitals. We were able to find them and purchase them at lower prices. There were a lot of speculators out there who took the price of these desperately needed things and multiplied them to take advantage of the COVID-19 epidemic. And because we didn't have the luxury of shopping for a better price, we paid more than we should have for these things. But at the end of the day, we did it because we wanted to make sure that we had it for county residents, and in particularly wanted to be able to support the work in the hospitals and doctors' offices that was still going on. And so that lesson learned out was as we started buying equipment, we bought the supplies for a long-term horizon rather than a 2-week or 1-month horizon, to make sure that we didn't run out of what we needed another time. We did better than most every other community in the nation. When the vaccine was developed, more than 90% of Montgomery County residents took one. And at one point, the death rate from COVID in Montgomery County was only 1/3 the national death rate. I used to watch the New York Times tracker. That's probably the first place I went every morning to see where we were. And for much of this time, Montgomery County had the lowest death rates east of the Mississippi River, and there were only a few jurisdictions west of the Mississippi that could compete with us. So I'm proud, not so much, the government did what we needed to do, but if you all hadn't listened and followed, we wouldn't have been as successful as we were. lots of people said that you should do things. Not everybody did it. It is very fortunate we were in a county where we could talk about health and we could talk about the risks that people are facing and what you could do to make yourself. And fortunately, most of you decided to follow that guidance. And the benefit is that there are more of us around today than there would have been otherwise. We're a very different place now. As I mentioned last week, CDC has consolidated guidance across COVID, flu, and RSV. And as you see from the chart, it's been over a year since we've gone above 100 cases per 100,000 residents. So that is really good news for us. Although we can now say we're clearly out of the woods, doesn't mean COVID's gone. It's pretty much not gone. It still carries a higher death rate for seniors and kills about 3 times as many people as the flu does. So we are continuing to make sure we track it, continue to look for outbreaks, and continue to work with our nursing homes, which were early on one of the most dangerous places to be because staff had to be there, staff wasn't vaccinated, nursing homes didn't have supplies either. And so it became a really difficult place to maintain safety. But we got past that, and hopefully we stay past that. I heard the term vaccination fatigue as an explanation for lagging vaccination rates, but there's no excuse for not staying up to date on the latest shots. The numbers show that they are actually still making an impact. Since 2021, unvaccinated people account for almost all of the hospitalizations and deaths due to COVID-19. Say that again. Unvaccinated people account for almost all of the hospitalizations and deaths due to COVID-19. It tells you something about the efficacy of the vaccine. A study published last year for the National Library of Medicine looked at preventable COVID-19 associated deaths due to non-vaccination in the United States, and it estimated that at least 232,000 deaths could have been prevented nationwide among unvaccinated adults during the previous 15 months had they received just the initial series of shots, just the first series. In Montgomery County, we came together in a way that many other counties in the nation were not able to do. We listened to the science and it helped save us lives here. The important improvements that we've seen over the last few years were only made possible by staying vaccinated. And I think that it's a point that's often overlooked. So let's continue to honor the vow to keep people safe. We're going to do our part to make sure you're safe and informed, because I do believe that informed people make better decisions. And we're going to encourage everyone to stay up to date on their vaccinations, stay home when you think you're sick, and remain vigilant now as we were then. Be aware of who's around you. Be aware if you do get sick about limiting your exposure, particularly the senior population or anybody you know who's got something that is compromising their health. Limiting the spread of COVID moving forward decreases the chances of future variants. Yes, the more it spreads, the more it multiplies, the greater the odds that a variant pops up. So stopping its spread and its ability to multiply reduces the number of variants. And you never know when you're going to get a variant that is, instead of a less dangerous trip, it doesn't turn out to be a more dangerous trip. So there's a lot of reason to be really careful even as we go forward. We're trying to protect our most vulnerable people in our community, and I think all of you understand that. Lives are still at stake, and now I'd like to turn it over to my health team for any updates they'd like to share before we take your questions.
Okay, I just wanted to mention from a surveillance standpoint, we have positive news that our outpatient visits for respiratory disease have continued to come down this week. Influenza visits are starting to come down, as are COVID visits and RSV visits. As far as inpatients, we had about a 40% reduction in inpatients with a COVID diagnosis this past week. So we went from about 44 down to 29 patients with a COVID diagnosis. So again, we think we're coming out of this wave of COVID. We will be vigilant for future variants that can cause new infections. And again, we appreciate the the more simplified guidance that CDC has developed and we're sharing that recommends individuals staying home when they're sick, regardless of their test outcomes, isolating at least until 24 hours have passed from them becoming fever-free, and their symptoms have significantly improved. And then at that point, it's still recommended to wear a mask and socially distance for an additional 5 days. And if you're going to be around people with that are higher risk, are seniors or other people with underlying conditions, and it's within that time period, we recommend testing to make sure that you're negative before you're around those individuals. We really want to protect our high-risk residents, and we want to continue to prevent transmissions and serious illness from this disease.
Thank you.
Sean. And I would just take this opportunity to reiterate the best preventive strategy and measure we have is vaccination to protect yourself as well as to protect our loved ones and those who are still vulnerable and high risk. As a department, we're going to continue to focus on our vulnerable populations and how we can support them and address the disparities, outreach, education, collaborating with our nursing homes, and figuring out how we can increase our vaccination despite that vaccine fatigue the county executive mentioned, to make sure that we are putting our best foot forward in terms of protecting ourselves, our others, and our community.
Thank you, Mr. Dano and Dr. Ashford. Dr. Bridgers and Dr. Stoddard, do you have any remarks?
Sure. The only thing that I would add in the absence of Dr. Davis is if you are experiencing symptoms of respiratory distress, contact your primary care physician. We are moving into allergy season now and moving from respiratory illness season. So if you think it's a cold, if you think it's an allergy, if you think it's flu, or if you don't know if it's COVID, please contact your primary care physician as the appropriate follow-up.
Thank you, Dr. Bridgers. Dr. Stoddard?
No opening comments for me today. Thank you.
Thank you. Members of the media, Q&A portion of the presentation, raise your hand. I see Enough Tash, I hope I pronounced your name correctly. Montgomery Community Media, good afternoon. You might want to unmute if you have any questions.
Sorry, can you hear me now?
Yes, you can. Thank you.
Sorry about that. So my question is, I have two questions. The first is there an update regarding the new search for the new police chief in the county? And then are there any remarks regarding the concerns of crime in downtown Silver Spring?
I guess a couple of things. On the police chief, I mean, there's nothing really new to report. We've given the council what the plan is. The first thing, we're going to look at a couple of internal candidates. We believe we have a couple of people who potentially could do this job. And just to explain the preference for that is that, a couple of things. One is, I honestly believe this county is much more advanced in its policing than most parts of the country, particularly any large city. So our folks have gone through a lot of changes. We did this big equity look at our police department, and we've done a lot of work to make ourselves a better department. We've got people who've helped manage that change. And I certainly believe that it helps us to have people who are familiar with who we are and what we're trying to do, rather than to try to bring somebody in who may not have worked in this kind of environment, may not have worked with unions before, may not have worked in an environment where equity is a priority. So we think our first best choices are likely to be here, but if we don't find, all the skills we want, we're going to take that outside. The second question was what crime in Silver Spring? I think that the perception of crime in Silver Spring is still there. It's still real. But the Starbucks is actually moving to another location in Silver Spring. That was one issue that was raised. And some reporter reported that this bookstore was leaving. They've got a sign on the door, but they didn't read the rest of the sign that said they're moving a couple of blocks away to a different location in Silver Spring. So I think that some of what people perceive as being magnified I mean, if you're a resident, you hear that Starbucks is leaving and your favorite bookstore is leaving, and they don't tell you that they're leaving to go down the block or across the street or something, that's a bit of a problem. It creates a perception that may not be real. But we haven't take this as it's not an imaginary thing either. So we've put a lot of effort into increasing public safety programs in Silver Spring. You'll find cameras in places we never had cameras before. You could say we never had cameras before on the streets of Silver Spring. Our police department has cameras on their vehicle that are able to read license plates and identify which plates are stolen or which vehicles are stolen right away. That's a capability we didn't have before. We've initiated a drone program in downtown Silver Spring and downtown Wheaton. Again, programs we never had before. And you'll see cameras on the streets in downtown Silver Spring, and we never had cameras on the streets before. So we've done a lot of work to try to get that image of Silver Spring to change. We've been very, I think, forthright. We've met with the community. They know what we're doing. So I feel that, there's still a perception. There's still more crime than any of us would like. But it's also true that we're making a lot of effort to push back on it.
Thank you.
Thank you, Nav. Heather Curtis, WMAL Radio. Good afternoon, Heather.
Good afternoon. County Executive Elrich, you spoke a little bit about the expanding the drone as first responder program. Just wondering which areas will it be expanding to, and how satisfied are you so far with the results from Silver Spring and other areas where they're being used?
I think the results, I mean, they've got a 6-month evaluation period, but if the results continue as they are now, I think people will feel that it's well worth the effort. I certainly feel already that this is well worth the effort. I think it's Germantown, Gaithersburg gets a site that can cover both areas. And why we can do it there and not in Silver Spring and Wheaton is there's a restricted fly area from around the District of Columbia, and you can't fly things. I think it's I don't know the number, I want to say 1.5 mile radius or something like that. But when you get farther north in the county, you're able to fly over a wider radius, which means you could actually cover much of Germantown and Gaithersburg. But in Silver Spring, the range of the drones is more limited, and that's federal law, not something we're doing. And then I believe Bethesda is listed next. We probably then I'm looking at the White Oak areas and other locations. So I think they're worthwhile. I think I know we're going to expand the number of them, and I hope we expand the hours. I'm interested in pushing it up to 2 o'clock in the morning. So that's kind of where we're going right now.
If I may add too, the other thing, Heather, that we've seen that's really advantageous is there's actually been places where we've actually been able to use the drones to not send police officers, which means they can actually focus on the calls for service where they do need police officer response. So one of the really good benefits of the drone program is that there's something in it for everybody, meaning there's opportunities to deploy officers to the places where they need to be. We're making more arrests with the drones. We're able to give officers, as they respond, more information on the ground about what they're likely to encounter when they arrive. And we've actually had several instances where the drones have been on overhead before the 911 call taker had finished their call with the complainant or the person calling, and we're able to dispatch officers, and we were able to actually, observe things and make decisions prior to the officers even being notified about what's happening. So it's been super useful in terms of getting more information to our officers and getting them to respond more quickly. And so, we're encouraged by that. Obviously, over the last, we've been seeing, for example, retail thefts at CVS's in places like Bethesda. And so obviously, as we expand the drones first responder program, we'll be able to address more of those moving forward. We've seen successes in Silver Spring, and so we know that it'll be useful in those circumstances in other places.
I will say, Earl, you
Sorry.
reminded, if I just say, I want to add on to what Earl said. One of the things they talked about was a drone arriving on a scene where somebody had taken a stance of like a shooter's stance and had a camera in their hand, and they were kind of rotating and pointing it around at people, and people were afraid they had a gun. And I can tell you, if the police had arrived on the scene and not been able to identify what was in that person's hand, very likely their guns certainly would have been drawn to start with, and it could have created a really difficult situation. The drone was able to tell it was a camera, not a gun, and tell the police officers before they arrived that whatever he's got in his hand is a camera, not a gun. You don't need to respond like he has a gun. That's a big deal, because those are the places where people make these, hair trigger decisions. Is it a gun? Is it not a gun? Are they going to shoot? Are they not going to shoot? And people sometimes make the wrong decision in those circumstances. So this is a great example of how knowing what was in the person's hand prevented a very different possible progression of events there.
Heather, did you have a follow-up question?
Yeah, sure. And actually, County Executive, you read my mind. I was going to ask what are some examples of, when it's been really helpful. And I'm wondering too, with the retail theft, Dr. Stoddard, would that be helpful? Because, sometimes you see people here and around the country walking out with huge bags of stuff and no one else, wants to stop them rightfully and potentially put themselves in harm's way. Would the drone allow the police to kind of track down those people walking out with these big bags of stolen goods?
It already has. And actually, we had an instance pretty early on, actually during the first month or so, where someone took a bag of stuff out, hopped on a metro bus, and the drone was able to follow the bus and get, track which stop it was at. Officers were able to meet the bus, walk onto the bus, and get the individual, arrest them off the bus. And in fact, I think actually there was a CVS burglary in that case as well. So CVS theft as well. So I think that it's a perfect example of what we're looking to do. And obviously, once those who are looking to take those actions, the criminals, know that we're doing this, perhaps they're not going to come to Montgomery County as readily or as often.
Thank you so much, gentlemen.
Thank you, Heather. Members of the media, any more questions, please raise your hand. More questions for the officials this afternoon? Going once? Going twice? Well, thank you everybody for joining us. Stay safe. Have a great afternoon. We'll see you next time.